Alrighty, hello there, folks. How you doing? Here we are. Today we're going to be talking about COVID-19. Obviously we're got a little bit of a worldwide approach here. We got Roel here over in the Netherlands. We got Mr. Capaldi over there in Scotland. We're going to be talking about what's going on with this. Obviously, there's a fair amount of misinformation running around. There's a lot of questions that maybe the answers aren't coming all that easily to, and everything. So we're going to do our best today to look into it a little bit. But like one thing I noticed myself when I was trying to look into this for the last 2 or 3 days is I was trying to go to the spots where I was originally going to look for graphs and charts and get an idea of how this thing was spreading and stuff. And it seems like, the last 2 or 3 days, those sites have backed away from doing it. So I thought that was interesting, but we obviously there are still some sites out there that are reporting the numbers in real time, and we'll be getting into some of that today. But yeah, I just found it interesting. I was really enjoying the LA Times coverage of it, for instance. But about 2 or 3 days ago, just dropped out. They're writing stories regarding COVID-19, but they're not doing any more like coverage of like the numbers and stuff like that, which I found disappointing. But obviously it's a huge concern. We all need to be very concerned about it. It's not fake or anything. It's not, it's a serious matter. Not everybody's going to die from this thing, but enough people could potentially die from this thing if we're not smart for it to be concerning. It's important for everybody to understand how important, that this thing is potentially very deadly to a certain percentage of the population. And so it's another reason why it needs to be taken seriously. I can say that I've been seeing social distancing being observed, and I'm hoping it's going to have an impact on the numbers at some point. Because, I know my hometown of LA looks like a freaking ghost town. I'm not kidding. It looks like a ghost town for the last 2 weeks. So, and that's kind of the way I feel about my area. I don't know what do you think about your areas? That, like you, Roel, for instance, they're in the Netherlands.
Yeah, well, I live in a small village, and that makes a difference because, well, in a village, it's always quiet, and it's a bit more quiet now, but not that much. That it's really not that much of a difference. But in the cities, you'll see the difference really. In Amsterdam and The Hague, Rotterdam, you can really see that it's much less crowded, especially since last week when the mayors of the cities got the regulations. They got the power to chase people away when they are flocking. Oh, sorry, that was my keyboard. When they were flocking together too much and
Gathering, right?
Yeah. So they are practicing social distancing, but well, I fear it's not enough because at the moment in the Netherlands. Already all our critical care beds are occupied at the moment. There just are no beds anymore. And well, our National Health Service discovered that only today. They didn't expect it. Well, yeah. I was writing on Twitter for 1 or 2 weeks. I say, well, at the end of that week, it will be full. And what do we do then? But somehow they didn't expect it, and they were surprised that it was already full. Right. So we technically don't have a lockdown, and people are still able to go out for whatever reason. They don't have to have a specific reason. They are just being asked to stay at home as much as possible.
Right.
But they're not being fined or whatever for going outside without a reason. And you can still get some friends at your house to visit. Well, I don't, but it's technically it's allowed,
right,
to get 3 friends at the same time at your house, and well, you may not call it a party, but,
Right.
but still, I think we have way too soft measures in the Netherlands, and I think we will have some more some real lockdown in the near future, but I fear it's already too late then.
Yeah.
Well, that's about the situation in the Netherlands.
Yeah, let's hope. Well, but let's hope the measures that we've taken. I don't know. I mean, I guess it's going to matter on. This thing has like a 5-day incubation period, they say.
Well, the average is 5, and the 97.5% point is 11.5 days. So
Okay, so
there's actually a full distribution. It's been studied extensively, and it's been misquoted in the news every time I've heard it discussed.
right. So okay, so 5 to 11 days, 5 to 12 days.
Well, the 11.5 days is the 97.5% point of the curve. It is a center weighted curve.
You mean okay? So you mean most of the cases are 11 days, is what you're saying?
No, most of the cases are 5 days.
Okay.
97.5% of the cases happen within 11.5 days.
Okay. Oh, I see what you
So in a small percentage, it will take even longer than those.
mean. A tiny percentage.
Tiny percentage.
Right.
And a tiny percentage happens as fast as 2 days.
Right.
That's a normal distribution, we call it.
Right. And from what I understand, I've heard anyway, I don't know how true it is just yet, but that you're actually not contagious until you're beginning to get symptoms is what I've heard. I don't know how accurate that is.
That's not accurate, to be honest. No, there is some asymptomatic transmission is possible. So, for instance, if you're speaking to someone, sometimes little drops will go through the air and land on the clothes or whatever of the person you're talking to if you're too close to him, and then if someone touches his face with those drops,
Right.
you will get it. So it's really possible to transmit it already when there are no symptoms yet.
Right. I would assume it has to accumulate enough to be projected in that way. So but right. I'm just curious of when a person becomes actually contagious after they've come in contact with it. So anyway,
you can't give a specific number of days for that.
It's hard to say. I imagine
the longer it takes, the more contagious it becomes. I guess, and from what I read, that's the case.
Right.
Well, it can't be a case of one size fits all, can it? There has to be people that get it mildly and some that get it more severe.
Yeah.
There's been a few questions in the chat. People asking is everyone in lockdown at the moment? So clearly Netherlands aren't in lockdown. What about you, dude?
No, the U.S. or California is not. They did issue an order Thursday night. It was, I believe, urging people obviously again to stay home if it's not urgent business, which from what I can tell is being observed for the most part. There may be a few bad apples, obviously, no doubt of that. But I mean, nothing punitive has been,
Okay. How strict has Mr. Peebles been?
Well, Governor Evers has had a voluntary lockdown in place now for close to a week. Our numbers are still rising. There seems to be a fairly standard rate of doubling every 3 days. Seems to be pretty typical of Western civilization. Right. And our numbers are still doubling every 3 days.
Yeah, I hear it's about 1,100 now.
But if you compare us to New York, I estimate we're about 10 days behind New York.
Right.
here in Wisconsin. Chicago is only like 6 days behind.
Mhm.
But both areas are likely to go as high or higher than New York currently is. I think what people aren't getting is, it took a certain amount of time to get to 1,000, but it only took 3 days to get to 2,000. So,
Yeah. And tomorrow it will be 3,000, I think.
Yeah,
Right.
I think the number for doubling every 3 days is 26% per day. So that's like the cube root of 2. So you get 26% of what's happened to date in the very next day. And until you get out of the exponential growth part of the curve, it's really devastating. You hear all these people in New York are under so much stress, but every day is just going to keep getting worse and worse and worse,
Right.
Until something changes. Now, we talk about this delay. There's 5 days average incubation of the virus, but there's a lag in the reporting of the test results, which, depending on where you are, is anywhere from 1 to 5 days.
Right.
And they aren't reporting the data on the day the samples were taken. I have no idea why they're not doing that. They're reporting the data on the day the test results come in. So the lag in the test results is built into this. So the data we're seeing is likely indicative of about 10 days ago. But
Right.
In
really,
reality, yeah.
But we really should be plotting it 5 days ago. So because that's when the samples were taken that they're getting results back on. In California, they have a backlog of 60,000 tests too, which I don't
Right.
know why they even bother testing that anymore.
Yeah, and that's what's happening in the Netherlands. They just don't have enough tests, and they say, well, we stopped testing all those people, and when we think someone has corona, well, just go into quarantine and we won't test you. So testing results and positive testing results really don't say much anymore in the Netherlands. So we count deaths. And we count hospitalizations. Hospitalizations are still pretty accurate, but it's nothing like knowing the real thing about how many positive cases are there. So that's a huge problem.
The problem with the hospitalization data is the public policy changes impact it. In New York, they were reporting that hospitalizations were dropping, but they'd also put out a public service announcement that people should stay away from the hospitals unless they're having severe symptoms.
Right.
And they also were repelling people by having long lines and making them stand next to people who were also symptomatic. So there's a lot of reasons for hospitalizations to drop that have nothing to do with the virus. The death numbers tend to lag original infection by about 21 to 28 days. So we don't expect to see them bend for quite some time. That's 21 days of having the virus before you die, and then the 5 days of incubation period.
Right.
So that's a very lagging number that most of the lockdown requirements went into effect only about a week to 10 days ago in the United States.
Right.
And you will only notice that in the death rate in about 10 days or something like that, or 2 weeks maybe.
Right, and then I think the United States is making a huge mistake of ignoring what's happening in Europe. There's this complete mind block where they keep calling the United States the epicenter of the breakout. If you take the largest countries in Europe until you add up to 330 million, so you could take Spain, Italy, Germany, France, and the UK, say, they'd have about the same population, and their situation is much, much worse than the United States. So,
oh yeah, at the moment, but it's just the United States is behind.
Yes,
a few weeks.
but nobody's looking in Europe for any models from the United States in the mass media or the.
And in Europe, it was already also a problem because we had Italy as our example. Italy was the first Western Europe country to attract significant numbers of these cases. So we could learn much from Italy, but many countries didn't. And I think maybe only Germany learned something from Italy, but UK didn't, Netherlands didn't, Spain learned a bit from Italy, but a bit too late.
Yeah, I think New York City is sort of our Italy, where the rest of the country is saying we're not New York City, so.
Yeah, not yet. Yeah,
Right.
actually.
But when you actually plot the data, there's a period where you go from 1 case to 10 to 100 that I'm looking at every decade taking about 9 or 10 days because we get a doubling every 3 days. So you have about 21 days where you go from 1 to 100 cases where they're getting lulled into the idea that they don't have a significant problem. And then, of course, when you go from 100 to 1,000, all of a sudden they wake up. The next week you go, the next 9 days you go from 1,000 to 10,000, and then you're in deep problem. So the problem is people are thinking that these low numbers, 1 to 10 cases, are some sort of indication that they don't have a problem. And
well, there are some countries now who recently only attracted the first cases, and they are going into lockdown when they only have about, well, maybe between 10 and 100 or 200 cases. And well, I think that's very smart, because if you're going into lockdown, you need to go in a lockdown early, because then it helps the most. If you do it too late, it won't help you enough, and your hospital system, your health system will be overwhelmed with all those cases, all those hospitalizations and stuff. So the earlier you do your lockdown, I think, the better.
And also, if you keep it at a level where you can quarantine everybody you find positive, and everybody who's contacted somebody who was positive until they test negative, you're doing a normal quarantine instead of, having everybody locked down so that.
That's what the World Health Organization also tells to those countries who do a early lockdown when they have not that many cases. The World Health Organization says, well, a lockdown on itself is not enough, because the virus will still spread, but much slower than without the lockdown. So to get rid of the virus, you need to use that track and tracing system. And for some reason, it went in our national press as lockdowns don't help. Well, it's bullshit, of course. Lockdowns do help. They slow the spread. And you need to do that to get your health system ready for those large numbers if you're too late with your lockdown. And if you're early with your lockdown, it can help you enable the tracking and tracing and getting rid of the virus.
Yeah, I think Singapore has a real good result now that people are looking at. But the problem is, if you take that period where there's only 1 to 10 cases, and you think it means you don't have a problem, you do the exact wrong thing. And then you end up with so many seed points that you have no chance of quarantining it.
Yeah, it was 5 in the USA that period. I think expected to be close to 0.
Well, it might have been if they had been more aggressive at that point.
Yeah.
But they let the genie out of the bottle. Now, pretty much every state per capita has at least 100 cases per million people. So that's probably enough seed points to mean that they're all going to see a pretty good epidemic.
Yeah. No
There was
tracking
an
and tracing possible anymore.
Sorry, Roel. There was an interesting comment by one strand in the
There you
RAV
go.
who pointed out that normally we love. Well, yeah, it was long before that one, but that was another one. But it was
Right.
about the fact that before this broke out, typically we would love to spend a day at home doing nothing, lounging about. And then all of a sudden we're told we're not allowed to do that. We have to do that. And there's almost like this reaction against, we don't like being told what we can and can't do we?
Well, in the States, there's a big counter lobby now saying that we're destroying the economy, and there's a lot of propaganda wars going on. The Republican-run states are trying to say that this thing is not that big a health issue, and that's going to cause us a lot of problems in the very near future.
Well, I have a question of my own. What would be the first sign of this coronavirus? Because I remember 2 weeks back seeing people sort of landing off planes, and immediately they were getting something pointed to their head. Was that to check their temperature?
Yeah. So there's it's used a lot by welders, but there's a surface thermometer where you just sort of pull a trigger on. First, you put like a red dot on their forehead and pull a trigger.
Yeah, right.
Those things cost a little bit of money, so a lot of people don't buy them, but they're the state of the art for quick temperature without any chance of material transfer.
We use them in my work to shoot the walls of a room to calibrate a thermostat for the heating and cooling.
Yeah, but when you're welding, you got to make sure welding surfaces have cooled to a certain level before you introduce certain things. And they're used all over the place, like in a shipyard. But for home use, they're just starting to get cheap enough. I think cheap ones are $50, and expensive ones are about $150. So,
right.
Yeah. So that would be the first sign, and then I take it the coughing would be the next sign.
And the temperature is actually the second sign. I think you start sneezing or coughing, and then you get the fever or the temperature.
Yeah. So I'm currently under a quarantine, but they didn't think my symptoms were enough to provide the COVID test because I have no respiratory symptoms. I just have a fever and headaches and some postnasal drip, and I have been held off. Up to this day, 95% of the tests in the state of Wisconsin have been negative for COVID, and most of them have been seasonal flu. So, I mean, we're still talking about the coronavirus being at a very low concentration in the population. It's just, it causes much more severe outcomes than the flu.
Okay. And the other question, sorry, that one strand in the RAV asked was about, well, there's been mention of, obviously, of Italy being particularly bad, but hardly any cases in Africa?
Not yet.
What they say is the season in Africa, or in the southern hemisphere, really, is not conducive with contagious diseases yet, and it'll come true in 6 months. They'll be the ones having the contagious diseases.
I think it's going to be much earlier.
Well, Northern Africa is in the northern hemisphere, so
yes.
And
I think it depends also on whether those countries have a vivid exchange with Western countries that already have the virus. So South Africa, for example, is being hit at the moment because South Africa is the most West European-like country in Africa. So they'll attract it first, and the northern countries at the other side of the Mediterranean, I think they will get it first, and they will spread it into the core of Africa. I don't think it will take 6 months.
Well, they're just saying that would be the normal seasonal flow. South America, of course, has a lot of commerce with Spain. So, and last time I saw a map, everything was lighting up. Those two continents were later in the game.
Oh yeah,
but
yeah, I think they're later, but not that much later. Not 6 months, I think.
Well, they're saying that there could be a second hit to us because their flu season could get so bad, and then we have people coming back from Australia or South America or Africa are going to reinfect the northern hemisphere. If we don't let everybody experience the virus, what we're doing is we're really just quarantining it and
until we have a vaccine, of course. If we get a vaccine.
And we're still searching for vaccines for some old viruses. So even the 18 months is, there are some that we don't have any vaccines. We should find some medicine that helps. SARS and AIDS are not solved. And
sorry, are more people who are getting the virus, are they mainly recovering, or are they mainly passing away? Do we have accurate figures on that?
Well, you can estimate the percent dead two ways. The upper estimate would be the cases resolved versus the deaths.
Right, yeah.
And that number's up like around 16%, but that would be an upper bound. The lower bound would be the deaths versus the total confirmed cases. And that number's running, that number runs differently as the number of cases in a country increases. So if you keep it at a low level, you can keep it at 1% or less. But if you let it get to the levels that were in Italy, I think they were seeing more like 6 or 7%. So,
yeah, and if your health system is being overwhelmed with more than currently in Italy, I think those numbers could rise up above 10%, because when people are denied critical care, they need the ventilators they need. More people will die, then your death rate will go up.
Yeah, so if you don't provide ventilators to everybody requiring a critical care, people who might have been treatable are going to die.
Yeah.
And also these models they have are very complex because they deal with all these issues. I've done a lot of reading about the research with the models, and they aren't forward predictive models at all. They're more like a calculation framework where you can do sensitivities to get a feeling for the range of outcomes. Anybody who says they can actually predict an outcome is not reading these papers very carefully. I'm a little worried that the governor of New York, Governor Cuomo, he's a little tied to this 30,000 respirator number he has. They've been careful not to show the simulation that they're using as their base case, but it is not a worst case number, and we have to hope that once they started the lockdown in that area, that they started bending that curve pretty good, and that we'll see the results in the next week, that it'll slow.
Right.
What we do know is during the period of exponential growth, which is what most of the areas of the world are in, if they haven't gotten to the point where the curve is bent, you're going to see about a doubling every 3 days. And if that
every 1 to 3 days, right?
No, it's early on. It can be 2 days, and then it moves to 3 days pretty rapidly. I think the 2 days is an example of where the collection of the data isn't mature yet, and the 3 days seems very, very common.
Yeah.
And it can sustain that doubling every 3 days for many weeks. And it's very important to go into the lockdown protocol once you've reached a certain number of cases. I think you can probably try to quarantine while your state or country is less than, say, 20 cases. But once you're at 1,000 cases, you're in a lot of trouble.
Yeah, certainly here in the UK, they've opened up the biggest exhibition centre, the NEC in Birmingham. Within 2 weeks, that's going to be fully kitted out as like a place to take patients to. It's going to have all the necessary equipment. Because, of course, here in the UK, the two big places that have been hit have been London, obviously, because, I mean, it's so densely populated, and the West Midlands, particularly around Wolverhampton, again, because of the dense populations.
But I think some of that's a confusion. When you look at total cases, those cities show up as high centers, but when you look at it per capita, they follow pretty much the same trends as the smaller population areas. I think this idea that somehow when you're living in a big city that you're breathing in each other's faces a lot more, maybe a bit exaggerated. Mm-hmm. Also, you only tend to transfer the virus to one or two people, so it probably takes more intimate exchange than just casually running into someone. The concentration the virus has to get in your system to become viable is something that I haven't seen any good research on.
Right.
Some things, I mean, you can just get a few particles of them. They may make you sick, but I don't think this is that dangerous.
Well, I was just going to say that in Italy, certainly in northern Italy, just literally been speaking just before we came on air with my wife's friend who is in Rome, originally from the north of Scotland, from Wick, and she was saying that the main problem with the northern Italy when it first broke out is that it is heavily populated. Also, it's quite polluted in the north because it's more industrial. And there are a lot of old people with severe respiratory problems, So is that why we're seeing problems in more densely populated area because of the pollution, air pollution, therefore leading to
Well, it could lead to more deaths, but I think it should not lead to more cases, more positive tested people. I think.
Well, and also. So the best case we've had in the States is the state of Washington.
Right.
I actually spent several days researching. I don't see any like magic step they're taking there, but they have in the state of Washington. They're politically pretty uniform. It's an extremely left state that. So there's it's not a battleground state where half the state's right wing and half the state's left wing.
Is that where Seattle is?
Yeah, Seattle. Yeah.
That's Washington State is like way over on the west coast, isn't it? It's just below Canada.
Northwest corner, near Vancouver.
Yeah.
So I think that state is what they've had is tremendous cooperation because they haven't had political squabbles. Governor Inslee is I think he's a good organizer and good communicator, but he's not the most charismatic person in the world, and his talks are pretty boring. I think what he has done is given them a clear set of very simple instructions, and then I'm seeing a lot. I think the mayor of Seattle's done well communicating that, and I think they've had a lot of esprit de corps just doing what they've been asked to do. I think you get to parts of the country where people are arguing whether or not the coronavirus is something to even be worried about, and you're getting confusing messages from the media. I think we're seeing a lot less cooperation. We're seeing a lot less following the guidelines. So I think if we could get unity here, just to fight this, I think it would go a long, long way.
So in Washington State, have they simply been following the instructions of social distancing, stay inside?
They have a nice. He did a nice 1.5-page letter. They're asked to do no travel that isn't defined as a necessity, which would be like getting groceries, or he has them clearly defined what they are. The restaurants are allowed to stay open and do carry out, but there's no dining out. There's some simple scoreboards they're following to see how much. I think they had a big improvement. So they got infected first, and they've already seen their curve bend because of their change in behavior. So I think getting through this sort of valley of death where you change the behavior, but the curve doesn't show results. When you start seeing results, I think the people start cooperating more. So it's that 2 to 3 week lag between first implementing a lockdown and actually seeing results, where people are just going really crazy.
Right.
But Washington was able to bend their curve at a much lower per capita concentration than New York is at. And they avoided really stigmatizing the community like New York's getting stigmatized. If I was in New York City right now, I'd be scared to death to go to one of those hospitals.
Right.
I mean, the last thing you want to do is stand in line with all these people that are coughing, and I know they have masks on, and they're long lines, and they're trying to bring you in a tent or something, but it's going to be harder to get people to cooperate around that.
No.
Right.
And,
So
and the
T1
other
is
thing
asking.
is that sorry,
Go ahead.
in the USA you have many uninsured people. Will they get hospital treatment? Will they get critical care if needed? And what can that fact do with the death rate in the USA?
I think Washington, Oregon, and California have very good policies, even for the indigent, for getting them treatment if they go to a hospital. So I think having people who are scared to go to hospitals or scared they won't get treatment is going to lead to more people who are infected floating around.
Right.
But I do think our West Coast is probably the best at that, though they complain that they have too many indigent people now that they treat them too well. But I don't see it so much in LA as I do in San Diego, and Seattle has a little bit of a problem.
Well, when you make the cost of housing too outrageous, it tends to create an indigent population. But anyway.
Well, I mean, California's got plenty of challenges. Let's not.
Sure. But,
amazing.
Okay. So T1 is asking, what is our future with this thing? How do we evolve with it? And basically, I would say that your answer there, T1, is we're not avoiding it. We're not going to avoid it. It's here. The whole idea is to slow it down so it doesn't overwhelm our medical system. But we're all going to eventually get it. And once we all get it, we'll all have herd immunity. And mothers will pass it on to their children through their antibodies moving forward. However, we still have to get through the initial rough spot, which is where this thing is spreading all around the world at the rate that it is, quicker than our medical communities are really capable of dealing with it. So that's what we're facing, and that's what we're trying to make more manageable.
Well,
yeah, we're talking about as many cases that are in need of critical care, maybe a factor of 10 or 20 or 100 higher than the capacity of that system, and that's why we need to slow down so much.
Yeah. Also, herd immunity is it's one endpoint for this, but what I've heard is you need 70% of the population to basically be infected with the virus to develop a significant herd immunity.
Yep.
Well, just any mom that gets it and develops antibodies, will pass those antibodies on to her offspring.
I'm not sure about that.
Sure.
Well,
Well,
it's yeah. I think there's some resetting of the immune system.
I've always heard that mothers pass their antibodies on to their unborn fetuses, but maybe I'm wrong.
Well, I think they protect their fetus with their antibodies while they're connected, but I think once the fetus is independent, its immune system isn't going to produce the antibodies the mother was.
No, I don't think so. If it were that way, then you would have inheritance of acquired characteristics, which is actually not technically possible.
But it's just that the more likely case is that we'll basically quarantine it off when it happens. We'll never see enough cases to develop herd immunity, and then eventually, hopefully, we'll develop useful treatments and maybe even a shot for it. And at that point, we won't have to worry about it. If we get 70% of 7 billion people having this thing, that would be a pretty bad situation.
Yeah, if it happens fast. We did the calculation in the Netherlands. Our prime minister did a speech and he talked about this herd immunity, and he said, well, that's going to be our solution in the end. It will be a scenario, but we will do it slowly enough so not too many people get sick at the same time. But when after that speech, I was researching and I was doing the calculation, and well, if we do it, it will take 8 or 9 years before we have enough people infected slowly enough to not overwhelm our system. And after 8 or 9 years, we will have 60 or 70% of our population infected and get herd immunity. So it's crazy to think that could be a strategy, and it was a strategy in the beginning in the UK. It was at some point in time it was a strategy in our country, but they dropped it 2 days later because other ones also did the calculation, and they say, well, you need to have a vaccine for that because otherwise it will take much too long. And that's true. If acquiring herd immunity takes too long, you will need a vaccine to make sure you can the people who haven't had that, who don't have that immunity yet, they need to get that vaccine, and then you can actually, well, not get rid of the virus. It will stay forever, but it will not invade our population anymore.
Do we know what that percentage is of the people that contract it, and how many need to be ventilated?
Yeah, the hospitalization data, I just did a chart on. So in New York,
shall we move to the chart?
Yeah, I just sent you some chart, link to look at charts. It'll help us just find topics, but it's right around 80%. And I fit a regression line through every U.S. state without New York in there, and then I just looked at New York's number, and 80% is about right for hospitalization. Well, 20% are hospitalized, 80% aren't. The percent hospitalized going on a ventilator is I think it's less than a quarter of the hospitalized cases.
Yeah, about 5%.
5% of the total population.
Yeah.
And then.
But that's based on 1% mortality rate, I think. If you have a higher mortality rate, I think also the ventilator rate will be higher. And
it's also ventilators are available, always available. So this first chart, if you just pull up the table, this is just, oh, that's bad. Oh, it was better the other view.
No, you only got half of it.
Well, we really only see the top. We can scroll on it. Maybe if you open just the artwork in another window, it'll work. Okay, so
that's about it.
We just need to tweet, I think.
Yeah, just the tweet's better than that.
Yeah. Don't. Yeah, this one.
I can see that.
Okay, so one thing I'm really upset at our media for is that they don't discuss per capita values very much. I've been sending them emails about this, and I've actually Chris Hayes got right back to me, which was sort of nice. But what we can see is on a per capita basis, New York and New Jersey are really the worst. But there's a lot of other places following it, and it's not necessarily the places you're thinking. If we look at the deaths per million people, a couple of points here. So even in New York, the cases per million people is only 3,000 cases. So that's still only, what, 1/3%?
Right.
So when you're talking about quarantining everybody in New York for driving across a state line, only 1 in 300 has this virus.
Right.
And the number of people you'd be quarantining would be, I mean, we're already limited in the number of people we can quarantine. Quarantining, 300 times as many people is not very practical. We're already telling them to only be driving across state lines to do
Essential.
necessary work. So,
Right.
just so even these 3,000, that's per million. In places, so one of the Louisiana, they're blaming the Mardi Gras, but even now, they only have 700 people per million, which is like 0.07% of the population.
Right.
So it's very few people actually have this, but a significant percentage of them are going to need hospitalization. So it's really more a problem with our hospitals. And when we look at the per capita numbers, we also get a feeling for in time when things will be as bad as New York. So what I'm seeing is these per capita numbers go up by about a factor of 10 in 8 days. So if we look at Illinois, which is where Chicago is, it's about 10 days behind New York. It'll be in the same sort of pain New York is today in 10 days. And then if we look at New Jersey, it's only like 3 days behind New York. It just needs to double. And Louisiana's needs to quadruple, so it's about 6 days behind New York.
Right.
But they're all these numbers are increasing. Also, as we look at the death rates don't correlate with the cases completely.
Yeah.
New Orleans seems to have a much higher death rate than the case rate would say. It's only got 25% of the cases of New York per million people, but its death rate is like 80% of New York's.
Which one's New Orleans? Is that Louisiana?
Yeah, LA. So they go by NOLA sometimes for New Orleans, Louisiana.
Right. Nolans.
I don't see Wisconsin on that list.
Wisconsin, I think. So this
Further down. Cali's number 36.
Now, California is getting more notice because of its huge population, but really its per capita rates aren't that scary yet. There's plenty of time to bend the curve there and not face a real bad outcome. Also,
I think we're doing a good job of it here. Like I said, LA looks like a ghost town.
Yeah, and Washington was ahead of New York and has actually crossed the curve. So there you see Washington's holding that case number down below 500 per million. New York's 5 times as much already, and that's because Washington put in effective lockdown.
Is that Washington as in Washington, D.C.?
Washington State. D.C. is the line. It's line 6.
D.C., even though it looks like it's doing better, it just was recently infected, where Washington was actually the first thing affected in the United States. So. Okay, we might want to go to the next thing. All right, so. All right, so one of the things, Louisiana is the southern state that's most messed up in terms of healthcare right now.
Mm-hmm.
It's having a crisis. And also, people are saying that it's due to Mardi Gras.
Mm-hmm.
So there's a couple of things here. Mardi Gras ended on February 25th, was the last day of a 2-week festival.
Right.
This year, February had 29 days because it's a leap year.
Right.
There's 4 days in February, and then we don't see our first case of the coronavirus till like the 11th of March.
Right.
So that's 11 days later, which is on the very outside of the envelope for the incubation period for this virus. And so are we saying that Mardi Gras gave us one person with this virus? It's possible it came from Mardi Gras. It's possible somebody flew in at some other point.
Right.
But this idea that there was some sort of mass number of cases coming out of the Mardi Gras is just a myth.
Yeah.
We don't even get to 100 cases until, what is it, that's the 22nd. It's like somewhere around the 19th or 20th.
Right.
So the idea that Mardi Gras was like spreading this thing like wildfire just isn't reflected in the numbers.
Right.
And the reason that's important is these other states that didn't have Mardi Gras are really following the same curve. So if we look at Alabama here, it's pretty much following Louisiana's curve, but it's about what 5 or 6 days behind. So I think
it doesn't seem to be accelerating as quickly as in Alabama there.
no, it's following the same curve. One thing to look at is how fast you double. So
Right.
So we don't have the 200 number for Alabama yet. Here's Mississippi. Mississippi was special because their mayor really thought it was important to not have a lockdown. And they look like they're, what do they look like? 2/3 of a week behind Louisiana. So they're 4 or 5 days behind. And they're going to be in a mess. So that's Louisiana, Mississippi, Alabama. They're all going to see problems. Louisiana had Mardi Gras, and Mardi Gras New Orleans is a tourist attraction, so it might have attracted
somebody with it, right?
First seed cases, but we're not talking about any significant number of cases coming out of Mardi Gras.
Right.
I mean, they had 200,000 people in the streets, and they're acting like they walked out of there with 10,000 cases or something.
Right. Right.
It's and for some reason our news is just in love with that. I did notice it's a big political issue down in Louisiana because they want to blame the mayor for having the Mardi Gras parade. But the truth is it's going to happen in all these southern states. It's just the timetable's shifted.
Right.
And Europe's going through a similar thing. In Europe, the different countries are a little shifted in time, but they're coming up and seeing very similar initial curves during this exponential growth phase.
Yeah, and there's a parallel within the Netherlands actually, because we had Carnival, which is sort of kind of Mardi Gras. So they at first the most cases were in one specific province, Brabant, and they thought, well, that must be because of Carnival, but actually the other provinces are now rising as fast as Brabant did in the beginning, and they didn't have Mardi Gras, they didn't have Carnival. So I think it's pretty comparable to those states with and without Mardi Gras.
Right. So it's and also you had this opportunity to maybe quarantine in each one of these states when it was in that early curve.
Yeah.
But they didn't do it. So and
Same,
remember,
same in the Netherlands. They just dropped the track and trace approach too soon in the whole country, instead of just isolating that specific province that wasn't going to be saved with track and trace anymore, and then try to track and trace the other parts of the country. But they dropped it for the whole country, and that was a huge mistake, I think.
no. Okay.
Okay. Sorry to interrupt.
Sorry, I've got a question then. At what point do you think the politics will decide that if the curve is starting to come back down again, that everything can be relaxed?
Well, the management of the curve coming down is important too. The good thing is if we build the hospital surge capacity, at least while it's coming down, we'll have enough hospital resources. But there are a few people with some innovative ideas on what to do on the other side, but it all depends on being able to test. That antibody test is really important. Knowing there's two things. They have to develop that antibody test, and we have to find out that you can't get reinfected easily. If you maintain your antibodies and you can hold off infection for a significant amount of time, then we can reintroduce people back into the workforce when they clear the antibody test, and they aren't going to be at risk of picking up the disease. I guess there's also a possibility that they could transfer the disease without becoming infected, but
through secondary transmission, you mean?
Yeah, through secondary, like
get it from one and transmit it to another one, and if you're immune, you can still do that. That's what you mean.
All the hygiene rules help there, where washing your hands and wearing the mask. And
but still, in Italy, we have now reached a point where the curve is flattening really in Italy, but they have a total lockdown. But still, only 1 in 600 Italians have been tested positive for this virus. So if they release the lockdown in Italy, it will right up. All those numbers will
right. The big problem is that so few people have been exposed to the virus that. I mean, this idea that everybody was, so we can pick to let people go back. That's a mistake. I think the health community will have more time to think that through. I don't think they have a perfect idea. I think there's a lot of confusion right now.
Certainly.
Yeah.
Okay, so I'm not sure. You have to click on this and let's see. I think this is 4 different charts.
It is. Looks like Florida, Georgia, Louisiana.
Yeah.
So Florida. Okay.
This is similar. So we looked at the deep South states where Mississippi and Alabama, and then Florida here. Florida's following the same curve. I mean, it goes from 100 to 200 in somewhere between 2 and 3 days.
Right.
And it's going to be shooting up just like the other one. It's going to be doubling every 2 or 3 days. Also, when we're hitting 100 or 200 confirmed cases, that was 7 days ago, and most likely we have more like 500 to 1,000 at that point in time. And doing the detective work to quarantine 500,000 cases or 500 cases is probably beyond the capability of that technique. So if you seed a community with 500 cases, so even though it's saying 200, on the day they're plotting that data point, it really is more like 500. Does that make sense?
Yeah.
The registration is behind.
Yeah. That's really, all that data should be plotted back to the time of infection, which is maybe 7 or 8 days back.
Prior to right. So this would be the deaths.
Yeah, so the deaths, Louisiana seems to be shooting up in death toll, and that might be an indication that they have a problem with their healthcare system. Or it may be, we also saw that in Italy, and it may be some other type of vulnerability. And it's definitely something to worry about, because in areas where that's happening, the death rates are much, much higher. Georgia's very similar, and it's also above 200 cases per million.
Right. Slightly higher death toll there, and it's like,
yeah, so 6 per million so far. But the bad part of the curve happens the very next 8 days. It's
right.
And so all these places are taking off probably in the next coming week. Okay, so this is just looking at New York State. So that rule, the cube root of 2 is 26%. So things are going up 26% a day.
That's high.
And then you see the death rates are shooting up too.
About 20, what is it now, 27 per million a
I
day?
think 37 is today.
Oh, wait, yeah, the most recent one, yes, right.
That was this morning. So I think somebody who's telling you this curve looks like it's hitting its maximum. I haven't even seen an inflection point in the acceleration yet. So.
Yeah, people keep talking about peaks. We expect a peak in a week. We expect a peak in 2 weeks. We expect a peak in 3 weeks. And I think, how can you talk about a peak? Because if you have a peak, it will go down again. The number of infected people will go down, or the number of deaths will go down, and that's when you really flatten those cumulative curves.
Yeah.
But I don't believe anyone who says who's talking about a peak in just a few weeks. What they really are saying is we will then have that high numbers. We can't take care of those people anymore, and that's what they call a peak. But it's not actually a peak. It will go up and up after that.
On the rate curve, it's the new cases per day LP, which is the derivative of this curve. But
but I don't think you can predict within even a few weeks on the derivative of that curve going down. I don't think so. Well, it's going to be much, much worse before it's getting better.
Yeah, because Italy, I think they put in the measures, and then they still saw it exponentially grow for 3 more weeks. So
yeah.
So we don't know when it's going to start to bend. The hope is it's going to be hopefully in the next week. I had some of these where I was comparing the United States to Europe. Can we try to find those? Because I think this is just total U.S. cases. That's some more on the Mardi Gras.
So if it wasn't Mardi Gras, what do you think caused it then? Just the fact that there's a lot of...
Well, there was...
in ill health?
Somebody infected came to New Orleans. It happened like a week after Mardi Gras, it looks like, and then...
it starts small, and then it grows.
See a comparison with the UK here.
No, it isn't at the bottom. I did them last. There's nothing.
It's this one here. It's the last one.
Oh,
looks like it's about Mardi Gras. And that's it.
Go back to the collection. Or what happens if you hit the arrow back to the collection?
The blue arrow, yeah.
Okay. So that takes us out of
That
it.
just took me out of.
Yeah. So.
All right. Well, there's rules.
Yeah, these are.
He'll have to do some translating for us. But
well, I have sent you a translated link.
you sent me one.
Yeah, if you take the next link in the messenger window, there's one right below, and it will give you a translated version of this page, which might be easier to understand for most of the people.
Dude, I thought you could speak Danish.
That's the mad Irishman talking again.
If we need Dutch charts, this side is the best. So I only see the one that I've clicked on here. Hold on.
I can send you the link again. Let me just give me a moment.
There will be some Dutch words though that are familiar. Yeah. Sometimes
I did send you the comparison table link in the Facebook chat. You want that's right. That's a tie point from the United States to Europe, which might be a good bridge for this talk.
I have the translated link here.
Excellent.
You want to screen share it yourself?
Oh, yeah, maybe that's better because I think the link is I get an error when posting it to the chat. So maybe I'll present it myself. That's okay.
Go ahead.
Sometimes when I try and get something from America, it comes up because we're in Europe. We can't get to see it.
Yeah.
I think that may be.
Screen. Let me do the right one. Okay, I'll take.
Gotta choose the right screen.
Yeah, the right screen.
Hey, there we go, and there it is.
What he's doing.
Yeah, you can see it here.
Yes, we can see it. Yep.
Okay, so this is allecijfers.nl, which is actually a independent site translating all those data they get from the National Health Service into graphs. And the graphs are much better than the graphs that are being produced by the health system themselves, because they create graphs that are incomplete at the end. So you get an exponential growth graph, but at the last 3 or 4 days it's going down, and they already showed it to the politicians and indicating that it was going down. But if you are looking at these graphs, well, it's mostly going up. Here are the
daily.
Yeah, this is the infections, the positives, the tested positives. But from the 21st of March, you can see here, they had a new testing protocol, so they didn't test as much people as they did before. So that's why those numbers were going down, not because there were less infected people, but just they didn't test anymore those numbers. Somehow, in the days after that, from 24th of March, the tested positives went up again, but the last few days they went down again. But I don't have too much. I don't think too much about those numbers, because we are not testing enough by far. So, but if you look at the cumulative graph on the right, then you can see it's still going up, going up, going up. And we've passed the 10,000 mark today. This is per province. This is the death rate actually, and last 5 days, the National Health Service was saying that the death rate was dropping. Well, today we had 132 deaths on one day, and it's the highest number ever. So I don't think it's really dropping. And cumulative death graph is still going exponentially. So that's
we call that interpreting noise in the States.
Sorry?
They're interpreting noise favorably for themselves.
Oh, yeah.
That happens in marketing and politics and a lot of
Yeah, they actually showed misleading graphs in our parliament. They had a briefing from the National Health Service, and they weren't clearly explaining what happened. They showed incomplete graphs, and it looked like it was going down, and it wasn't. So, and this is the critical care numbers, critical care figures, and there's something really strange going on here because the hospitalizations are still growing steadily. So you would expect the critical care numbers to grow in the same way, in the same manner. So it did kind of until the 26th of March, maybe the 27th, but then they suddenly changed the counting system, and they said, well, these figures were on a website called NVIC, and until the 873, it was very regularly growing. But from yesterday on, they told, well, we're switching the count to another website, and that website also did count before the 28th of March, but it was much more behind. So that number of 32 is bizarre. It can't be true. If you calculate, well, today we would have filled up the maximum capacity of critical care. It can't be any different because the hospitalizations grow in the same way as they did. So the critical care has to grow in the same way. So it's underreporting those two bars here, those two last bars. And I really don't know why they changed the count, something to hide or something like that. I don't know, but it's very strange. Right. So these are the hospitalizations, and the last days they've said, well, hospitalizations are not growing as fast as we would expect, and it's going down, but today were the most hospitalizations in one day already since the start, 529 hospitalizations. Right. And you can see the cumulative graph on the right also growing, and all those hospitalizations will in the end lead to, well, 25% of those hospitalizations will end up needing critical care, but they won't get critical care because they're now talking about maybe creating some extra critical care beds and then going to 1,100. But they're now estimating that within 2 weeks we'll need 2,500. And they just aren't there. So we will see a flattening of the curve here. But the only reason that the curve will flatten is that people won't get critical care because there are no beds anymore. So you can't go above the curve. That's not possible. Which will
tend to cause your probably death numbers to skyrocket a bit.
Yeah, right. So instead of rising intensive care, critical care numbers, we will see rising death rates. Or we will see, and what we already saw today was they are moving patients needing critical care from Holland, from the Netherlands to Germany, because Germany has many more critical care units than the Netherlands. We actually have 5 times, the USA has five times as many critical care beds per capita as the Netherlands have. So we have very little of those units. And Italy already has double the number of critical care beds compared to the Netherlands. So that's a scary figure for us. We will be overwhelmed much earlier by all those patients needing critical care than Italy, and even earlier than the USA. It seems to grow very fast in the USA, but in fact we will have those problems much earlier than the USA, except for maybe some specific regions.
Right.
So these intensive care unit, critical care is quite scary because the capacity is so low.
Right.
That's the problem.
But if sorry, Roel, if in Holland, I mean, obviously, yes, you're saying that they're sending some to Germany because they've got plenty of capacity, but also, as I say, here in the UK, they've opened. Within 2 weeks, they're going to have a huge facility at the NEC that's going to be specifically for organising, as you say, critical care beds. Are there? I mean, there will be similar facilities in the Netherlands, but is it a case of there just isn't the staff to do that? That
will also be a problem. They might get ventilators. They already got something like 100 or 160 ventilators from Philips or whatever, and that will be enough for maybe 1 day extra. And then if you get more ventilators, then comes the problem: who's gonna handle those ventilators? You don't have enough staff, and you need to learn to teach your operation personnel to handle those things in just a few days or something like that. So it will yeah. So they might do it with one experienced person and one rookie together, and then after a day they need to do it on their own, something like that. So finally, here is the patients admitted to hospital, 529 a day. And we have here a comparison with the Netherlands and Italy and the United States. But these are the infections, and because our testing figures are so low, you can see our line is very low, but that's not a good sign, because it doesn't mean we have low numbers, but we don't know how many numbers we have. So it could be here or there or even there.
Well, so something else has just occurred to me. Is if you've got hardly any traffic on the roads, you're not going to have the anywhere near the need for accident emergency of, for example, road traffic accidents, which
Yeah, that's true. So that might give you a few extra beds, but at the moment they are advising that each hospital with a critical care, they need to reserve 2 or 3 critical care units for those traffic victims or whatever. But it's just it won't help much. But the thing is, if you count from the 100th positive test, then the USA is growing much faster than even Italy, you can see. But that might be because there is so much testing being done in the United States. So it's yeah. And if you look at the standardized figures, okay, sorry, I forgot that these are the actual absolute numbers, and these are the numbers per capita. So we're not that much below Italy, actually. Okay, I think these are the graphs I wanted to show. Well, this is the Netherlands, and you see this is Brabant, the province I was talking about, but there are also some areas here in Overijssel and Zeeland and Limburg, which do have many cases.
Right.
And I'm living here in Midden-Groningen, which is fairly light, so we don't have that many cases in my region, but well, it's gonna be just later. It will be there. I think this is what I wanted to show. Something like that.
Oh.
Yeah. Okay.
That's a plot that didn't plot per capita, so it's like.
So what didn't plot per capita?
They had that plot showing all the different countries, but they were just total cases.
Oh, it's the one he was asking me to find, but it wasn't there. Yeah.
Okay.
So, all right. Well, I mean, obviously, we hope that we're, social distancing is going to have an effect or enough of an effect. It's worrisome seeing the numbers grow. I agree. Can't help but be concerned.
I think we need a lockdown, and anyone who's not in lockdown yet, I would advise get a lockdown as soon as possible, because it will overwhelm your health system sooner or later if you're not doing a lockdown. Unless you have a small number of cases you could track and trace, then it's not a problem without a lockdown. But if you have enough cases above a certain threshold, get a lockdown, the earlier the better.
Well, like I said, I'm proud LA, got on the ball 2 weeks ago, 2 Mondays ago, our kids didn't even come back to school after the weekend. And so it's been 2 weeks that it hasn't been running around in our, public schools and colleges. Kids are doing online lectures and stuff now for their college classes. I've seen evidence of that because I've been, in one particular home I was working in the last week. So, I mean, all these things are happening. People are taking this thing seriously. Is everybody? No, I'm sure there's a few bad apples out there who are like, screw this, party on, drinking, whatever, carrying on, just like business as usual for them. I'm sure those people exist with large groups of people. And really, that's what we need to avoid, folks. Large groups of people are the problem here. And you need to be careful when you're going into the stores to get your supplies, even. Because you're in there with enough people, you need to be taking precautions. You need to, be aware of your surroundings. These are the ways that we'll do this. And wash your hands. Just continue to wash your hands, because that's the one thing I keep saying. Every doctor say about this. There doesn't seem to be any disagreement on this. Wash your damn hands, because they all seem to agree that it works. So,
really, but also I'm surprised by the number of people that don't know how long a good social distance is. We do 1.5 meters. I think in the States you do 6 feet. 6 feet. Yeah, and some people really don't seem to be able to understand what that distance is. They get so much closer to each other. I don't understand. I saw a picture lately of Oval Office, and I thought, whoa, what is their distance?
Yeah, right.
2 feet?
Yeah, it's true. I mean, it's still, I mean, I imagine a lot of it is people are getting out of the bad habit of just walking up close to somebody in the line in front of them. I mean, I imagine some of this is going to be about breaking bad habit. That picture that you're talking about, well, they should have been well informed enough. They should have realized they should have been, observing social distancing. So that situation, I think, is a little different. But you're going to run into those people in your local stores, folks, who are not going to be thinking. They're going to walk right up behind you in line, not thinking about social distancing. So that's where it relies on us to be classy and to turn around and say, excuse me, but during this time, I really would prefer it if I could maintain a social distance of 6 feet. You know, if they're not a jerk, they're going to be like, oh, I'm sorry. Yes, you're absolutely right. You know,
well, no, here in the UK, you've got the shops actually enforcing that. For example, the local big supermarket, instead of the two entrances and exits, they've made one the exit, one the entrance, and they've actually put arrows. You're only allowed to go down certain aisles. You know, so for example, for me to go all the way around to one part of the shop that I needed to get to, I had to go all the way around the shop, whereas normally I would just go straight there, but I had to go all the way around. So, you know, I would say that here in the borders, everybody is paying attention to this distance. Yeah, you know, everybody knows it's 2 meters or 6 foot.
Yeah, one-way aisles would be a very good idea because you can't pass each other within one aisle while keeping your social distance. So it really should be one-way aisles. But they're not being enforced everywhere. That's the problem.
I mean, literally, the store where we're just around the corner from us, at 8 o'clock till 9 o'clock, they have it so that so it's elderly that can go along and do their shopping, right? And they don't even let them in huge numbers. There's been pictures of them queuing up in the car park, and again, the queue looks longer because in the queue they've been told to stay a certain distance,
Right.
And, the complete opposite to when you're typically queuing at an airport,
Yeah.
Right.
Right. There's some confusion about what 6 feet actually is and what 1.5 meters is, because 6 feet is not really completely 2 meters. It's 1.8 or something about that. And we have the rule 1.5 meters, which might be 5 feet, I think. But in USA, you use 6 feet. Well, it's 5 to 6 feet in most countries. Actually.
Right. So we're all in the ballpark. We're in that area, so we're good.
Yeah.
So.
Unless you got feet as big as Erekose.
Right?
Yeah.
Bigfoot. Sasquatch.
And well, there's a problem. Some say that guys actually are not as good in estimating their social distance as women.
Oh, that sounds.
And they say because
that sounds awfully sexist.
They estimate this is not a half a feet, guys.
Yeah.
I knew exactly where you were going with that,
pal. All right. That was funny.
Are you sure?
Anyways, I think so. Should we have a discussion? I mean,
not about that.
See you later, guys.
Guys rules. Guys don't talk about other guys' junk.
Yeah, that's generally true. That's true for the most part.
Yeah.
I hope always.
Talk about your social distance. Anyways. So I think we've covered a lot of things here today, covered a lot of ground. I think, we all just got to kind of suck it up a little bit. It's going to be uncomfortable the coming months, obviously. Not going to be ideal. Life isn't usual, but ultimately in the end, so that we don't have to see so many people die, I mean, I think it's worth it. A little bit of discomfort, a little bit of, taking a little bit more care about, how you interact in public. I encourage everybody, if you're going out in public, get yourself a mask, to wear a mask and possibly even gloves like I do. If I go into a store, if I'm at the gas pump, certainly at the gas pump, because folks, you got to think about things that people touch, that lots of people touch. And gas pumps are one of those things. going, the handles when you're going in and out of stores or anything like that. So that's why I wear gloves and a mask for whenever I'm out and about, because I'm an essential worker. Obviously, I'm out there, I'm fixing people's internet, making sure they have TV so they can watch the news during this time. I'm doing things out there that are pretty necessary, and I'm taking these precautions. And I know those of you have to go out and do your shopping, or you have to go out and do things like that. I advise you to take the same precautions I take. It's just all these things help in slowing the spread, so it's important. Any thoughts, guys? Closing thoughts?
Well, can I just say, really enjoyed another chat with you guys, and a big shout out for Linda, who got to 1,000 subscribers.
Yep.
Oh yeah, congratulations, Linda.
Whoop 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 whoop.
You're here.
So congratulations, Linda.
I'm ready for dinner.
Okay, the gorilla's hungry. He's got a stack of bananas he's got to get to. So yeah. All right. All right, guys. You guys know the song and dance. Thank you for being here to talk with us about COVID-19. If you haven't already, please hit subscribe, and we'll see you.
See you.
Happy lockdown.